Future Surgeons with Professor Dr. Zahid Mahmood. Welcome to the Surgical Learning Series with Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College. Let us master today's important SEQ, simple, focused, and exam-ready.
SEQ 21. A 25-year-old housewife has a 1 by 1.5 centimeter swelling on the back of her neck for 1 week. It is painful and tender. Answer: the diagnosis is sebaceous cyst. Management depends on infection. If no infection, excise the cyst under local anesthesia. If abscess has formed, do incision and drainage first. Later, perform complete excision of the cyst wall. In exams, always mention both steps. Drainage first if infected, then excision later. SEQ 22. A 70-year-old diabetic woman presents with redness, swelling, and pain in her right arm. She also has fever with chills. Answer: the diagnosis is cellulitis of the right arm. Management includes appropriate antibiotics, proper analgesia, rest of the limb, icing and elevation, compression with elastic bandage. Always remember, early treatment prevents spread and abscess formation. SEQ 23. A 30-year-old motor mechanic complains of weight loss, hand tremors, and anxiety. He has a visible neck swelling and pulse of 115 per minute. Answer: the diagnosis is thyrotoxicosis. Investigations: thyroid function tests T3, T4, and TSH. Thyroid antibodies, thyroid scan, management options, anti-thyroid drugs, beta blockers for symptom control, radioactive iodine therapy, thyroidectomy in selected cases. In exams, always list investigations first, then 3 clear treatment options. SEQ 24. A 40-year-old housemaid developed a painful 8 by 8 centimeter swelling in her upper arm 2 weeks after a multivitamin injection. The area is hot, red, and fluctuant. Answer: the diagnosis is injection abscess. Management: incision and drainage under aseptic precautions. Allow secondary healing. Send pus for culture and sensitivity. Biopsy the abscess wall if chronic. X-ray the arm to rule out osteomyelitis. Always include both surgical treatment and relevant investigations in your answer. SEQ 25. A 25-year-old office clerk complains of pain and fatigue in his right arm after prolonged desk work. His radial pulse is weaker than the left. There is a firm swelling in the right supraclavicular fossa. Answer: the diagnosis is symptomatic cervical rib. Investigation: X-ray cervical spine and chest to confirm the rib. Treatment: extraperiosteal excision of the cervical rib. Remove any bony prominence from the first rib as well. Closing: this SEQ overlaps with thoracic outlet syndrome. Mention the investigation and exact surgical treatment.
You have been learning with Professor Dr. Zahid Mahmood, Professor of Surgery, Lahore Medical and Dental College. For more SEQs and surgical tips, subscribe now and join us again for your next step toward exam success.